working with the pranic body is often the easiest way to affect doshic imbalance. And that's really why pranayama is considered so powerful. Because unlike when we're working in the other layers of human existence, like really this directly, right, will affect the balance of doshic energy in the body. Now that said, it's also important to establish, proper breath patterns for pretty much every condition, because the breath is physically indicated in many systems of the body, right? So improper breath patterns literally cause the system to break down, and then disease follows. And the cascade of problems that can happen because of incomplete breathing really can't be overstated. Blood pressure, organ health, nervous system, immunity, just to name a few, right, are all serviced, right, by proper complete breath. So for almost every condition, as a yoga therapist, you're going to want to teach proper breathing if it's not happening naturally. So you're always going to be assessing that on like the sort of physical level with the breath. And then, we're looking at assigning proper pranayamas, like for which conditions. The way I'd like you to think about it is through the Vata, Pitta, Kapha model, which again, just so, when you're working with individuals and you're not confused, Vata, Pitta, Kapha are just general descriptors or groups of patterns in the body that you might be trying to rebalance. So when you're thinking Vata, you're going to be thinking about a client that's having trouble concentrating and, or sort of bopping from one thing to another. Not in a manic way, just a problem with clear, non-delusional, focused thinking. So most mental imbalances are going to require Vata imbalancing. The other thing is that Vata balancing pranayamas, right, balance people's thinking. So they are often indicated for many conditions, even if you're using another pranayama, right, because you want to balance their thinking so they can see things clearly as part of the education process. The other big area where you probably think about Vata is left and right side issues. So when you see something that's really one-sided, you're going to think, maybe in addition to other things, but definitely Vata balancing is going to be required, so the Vata balancing pranayamas will help. And that's true of any kind of left-right thing. I just had a client, actually today when I'm filming this, that's having this sort of like veering off to the left problem. And that is one of the things we did. So anything where you right, left sides, nerve stuff, anything, it doesn't matter what system in the body it's in, think about the balancing. The other area would be disorders in the home of Vata, which is the pelvic region. They might benefit from Vata pranayama, like pelvic floor issues, urinary and bladder conditions, that kind of thing. You could think Vata, and it definitely wouldn't hurt. So let it come up in your mind and then say, okay, well, this is in the area of Vata. Let's try this and see how the client reacts. The other place is like inconsistency. So especially like in pain. So if pain is moving around and mobile and not consistent, right? So, your hip hurting all the time, is not really, you might get some benefit from Vata pranayamas, but sort of like that darting around kind of pain, or in and out, that kind of thing. Or mobile pain where it's not located in one place. That is definitely, you want to be thinking Vata. And then finally, it's always useful because of its mental implications for rebalancing highs and lows. So when you perceive somebody to be just sort of not balanced, like their highs are too high and their lows are a little too low, and they are languaging that is a problem for them, because it's not really our job to assess that. It's more to help them work with or fix problems that they've identified as problems. So when a client's giving you that, you might think Vata. So then next we have the Pitta pranayamas, And with Pitta, mentally, you're going to think of conditions that involve overactive mental states like obsessions or anger. So anything that falls into those kind of realms, definitely rebalancing Pitta is going to be important. Now, as we said, you might be rebalancing. You're not necessarily stoking Pitta, you're rebalancing and bringing it home for things like that. Also, what I happen to see a lot is inability to sleep due to too much energy. This kind of, not being able to settle down. And it's not exactly anxiety, although that can be part of it. But a lot of people will experience this kind of like not able to work their way down towards sleep, and that is often a Pitta problem. Physically, what we usually see is inflammation and heat, right? Because Pitta is fire. So arthritis, swelling of the joints. You also see in imbalanced Pitta people's inability to handle heat, and that should make you think Pitta. Now, just like Vata, right, where we had the pelvis, also Pitta, you're going to think of the region as well. So it's the belly, abdomen region. And what you want to be thinking about is slow digestion, things like that, or heartburn. So those are two sides of the same coin, either, stoking Pitta for things that involve things not moving along like they should. And on the other side, you've got heartburn where you've got too much rising, right? So you want to rebalance that and bring it home. So that's both Pitta as well. And probably the most important thing with Pitta is that Pitta conditions are often really overactive. So to work with Pitta, you'll have to be, really focused on getting the client to sensitize, right? Do not stoke Pitta for overactive conditions. What you want to do is sensitize people to their own bodies so they can have the heat be in an appropriate area, which usually for Pitta, right, is in the belly, maybe slightly up into the chest, but not burning them up. So those are the kinds of things you want to think about for Pitta. And then for Kapha, Kapha is a little sort of simpler in a way to diagnose, because what you see is mental lethargy and what you might call depression, right? But slowness mentally and slowness physically. So whenever you're thinking of slow, lack of inertia, you're going to think of the Kaphas, or low energy. You're always going to think Kapha. Okay, I got to get that Kapha moving. The other place you see Kapha a lot is, of course, this region, the chest area. The way that's going to manifest is usually like a lot of colds, or a lot of mucus, or conditions like bronchitis, like things like this. And you can think of all that as lungs and sort of low energy, not allowing things to work. And that's always going to be Kapha. So I'm usually working with Kapha, in my practice, where it comes up the most is chronic low energy. Everything from, actually diagnosed low energy disorders all the way up to people just saying, I don't have the energy I want. I just have a basic low energy. Then often Kapha is indicated. And it could be, in pranayama land, we're doing the pranayama Kaphas to get things moving, and just remember in general, right, you're trying to get them moving physically too. So that would often be in combination with physical movement, working with the Kapha. So many conditions, right, cross these boundaries, but it's always going to be important to make a decision on what dosha, Vata, Pitta, Kapha, is the primary issue. Let me give you an example. So you have a client with lethargy and arthritis. Maybe they have an inability to focus, and maybe that's due to pain and low energy. So then the question you got to ask yourself is, what's the primary doshic imbalance? And the way to get to that, the way to start working with that is ask yourself, why has this person come here? Don't second guess the client's presented problem. If they come in and they say joint pain is the problem, then you go with Pitta, right? Because they have inflamed joints. If they say, yeah, I have inflamed joints, but my real problem is that I have low energy, then you go with Kapha. You let the client lead the way, right? You don't try to second guess them. You might change strategies later based on information, right, that you get from a client once you're working with them, and you see how these either positively, negatively, or don't at all affect their situation. But you don't put your own sort of thinking on top of theirs at first. And the other part of the art, I think, of this is to not aggravate the other doshas while treating one. So, for example, if you want to boost kapha for lethargy and the person has arthritis, then the pranayama, right, should both enhance their energy, but you don't want it to make their inflammation worse. So when you're tweaking the pranayamas, amount of times, amount of effort, how they should feel while doing it, that's what you have in mind. Because really you're always working for this result, and that's the art. There is no simple answer to this. And I've actually been around other systems that sort of have prescriptions, and they don't work once you start working clinically. So you really need to have a person in front of you, try your kapha pranayama, and then it didn't really work, I had more energy, but I feel worse. Good. Then you reduce it, right? You have input. So it's always this relationship that you're working with. It is rare, in my personal experience, to see a pranayama resolve a physical condition completely. It's not magic. But what you will see, and if you work with a lot of people, what you'll hopefully see often, is a real reduction of symptoms if the pranayama is correct. So the way that usually ends up working well is having the ability to work carefully and and have your client not overstep the instructions you give them, and also you not giving them something that they're not really able to do easily or correctly. For example, you wouldn't give bandhas until it's clear that the preliminary steps of the breathing can be obtained, right? This is very easy to do because, of course, you want them to get better and you have this idea, I'll give them more and then it'll work even more. But what happens is when we overreach in this way, it causes frustration, and unfortunately it causes more pranic imbalance. So you actually get the opposite effect. And you can lose a lot of clients this way if you overreach. So you go one step at a time. Don't worry about working slowly. Don't worry about that. So let me now give you a couple case studies where pranayama was a main factor. I was thinking about it and I was looking over some notes. And this first one I found really interesting. And it's the example of a kind of condition that I think yoga therapy is really good for. It was vulvodynia. It was a client in her mid-30s. And vulvodynia is a condition where a woman's vulvar region was, as she described it, on fire and in pain much of the time. And she had been to several medical professionals who offered some self-care techniques, like using ice, basic kind of things, but it hadn't really helped her. And I listened to her history, and although there were many things I could have latched onto with this, she had tried, these self-care things and some dietary changes. And they hadn't really worked. And so this is common in yoga therapy because you've got this condition that there isn't really an awesome treatment for, right? So I decided to think in a doshic way for this particular person to see if she could obtain some relief. And just to give you a little background, she's a really successful, driven individual, super fast talking, pretty angry, but also very open, which, that combination with this really active pitta, right, mind, but open to things being different, made me feel like she could be sensitive enough to do this work. So we worked with two techniques. First was some complete breaths, engaging the pelvic floor on exhale and releasing on the inhale. And The reason I used this was to sensitize her to her breath and pelvic floor. And I was especially mindful to teach her not to engage strongly and really release on the inhale. So the exhales were really light engagement. And that took a little while. This is really new to her. But once she mastered this, followed it with Kapha variation with the Pitta balancing breath. And it was mainly to get her to be able to heat lightly her abdominal area, not above, as I've taught you. And this took, because she was so Pitta, very few breaths, so she only did 8, maybe 10 per round. And then finally we ended with that same complete breath and then cooled down. So this was her homework, basically. And in 2 months, she reduced her pain about half, as she described it. And in 6 months, she was 95% pain-free, right? Just an occasional little tiny flare-up. And I added some quiet meditation to help the system stay balanced as a helpful piece. And then I didn't hear from her for a couple years, and 2 years later she reappeared and said it basically stayed the same. Like, she had very little symptoms, but she had hit a really stressful part of her life and sort of needed a refresher. And I did a little variations on the same theme, a little bit of asana actually, because I thought it would help her at that time. But the point of this is, like, after many medical professionals, this very, pretty simple pranayamas, a huge effect, the sensitization. So that's one case study that struck me as I was looking through. And then another one that I thought would be more common is I got someone with chronic constipation, a woman in her early 60s. And the first thing I noticed is that she was a reverse breather. So we worked together for a while using asana because originally the breath instruction wasn't working. And I tried it on her back and standing, and it just made it worse. So after a couple months, it was 4 sessions, asana, with no real result. I changed tactics. And she was really Vata imbalanced, all over the place in conversation. And although I wanted her to do belly breathing, she couldn't make it happen. So I switched hacks and had her do alternate nostril breathing. We focused on exhales and lengthened the out breath, really simple. And this she could do. So I asked her to do it 3 minutes 2 times a day. And she decided that 4 or 5 times a day would be better on her own. And that seemed to work well. I noticed when doing asana, the next session, right, she was belly breathing. So long story short, she found herself constipation free very soon after that. And she followed up with me a few months later when she had a small bout. But it was really mostly to thank me, right, for how well she was doing. And I basically just told her to keep doing the same thing, and that worked again. As a woman who had been chronically constipated for a very long time. So there are just a couple examples about working with the pranic body can often lead to really amazing results. And the thing about these 2 clients is that they both actually surprised me at the time. And the great thing is that the clients really took control of their own healing. So to dip underneath the physical kosha into the pranamaya kosha can be really empowering. And our skill as a yoga therapist is not just in techniques, but being really, really sensitive to what a client can work with, and seeing if we can find a way to make, take the thing that what a client can do and sort of expand and enhance that so that they can benefit. Om Shanti. Om.